Dalhousie, Medicine, New Brunswick, is located in the traditional unceded and unsurrendered Wolastoqey territory. We also recognize the histories, contributions, and legacies of the African Nova Scotian and African New Brunswick people who've been here for over 400 years. On behalf of the Curriculum Refresh Working Group, I'd like to take this opportunity to welcome everyone to today's Town Hall feedback session. My name is Dr. Evelyn Sutton, and I'm the Associate Dean, Undergraduate Medical Education. So this is not our first, town hall, but for those of you who didn't join us for any of the previous ones, just a recap, the Curriculum Refresh Committee was formed in August of 2020 to assess the strengths and gaps and areas for improvement of the pre-clerkship and clerkship years of our undergraduate medical education program. Working groups were formed to explore the identified themes and have been spending their time over the last 6 months reviewing objectives, course content, and student evaluations. They've conducted environmental scans and literature reviews and consulted with groups and individuals. So the purpose of today's session is to gather feedback from the medical community on the work completed to date. So how today's session is organized, Dr. Sean Christie, Chair of the Working Group on Planetary Health, including Climate Crisis, will provide a brief summary of the group's review to date. Dr. Christie will then open up the meeting for comments and feedback. So please raise your hand if you'd like to make a comment or ask a question. You'll be asked to unmute so you can speak. Please introduce yourself prior to your question or comment. Give your name, department affiliation with the medical school. And you can also type your question or comment into the chat box if you prefer. Just let everyone know this session is being recorded, and the minutes of the meeting will be, and the recording will be available on the Dal website. So I'm delighted to introduce Dr. Sean Christie, who is the chair of the Working Group on Planetary Health. And when he's not doing that, he's a surgeon. So welcome, Dr. Christie.
Thank you very much. I'm just trying to turn my camera on there so that I am actually here. Thank you very much for that introduction. And perhaps before we get started, I just want to wish everybody on the call a very happy and all the best for International Women's Day. I'm going to try to share my content. Can people see the slides?
Yeah, looks good.
Does that look okay?
Perfect.
All right, thank you very much. So as Dr. Sutton pointed out, we'd like to present some of our thoughts to date of how planetary health can be incorporated into the medical school curriculum. And despite a lot of work being done thus far, this is still a launching point for work to be done, and really hope that we get a lot of comments and suggestions as we go through here. So to start off, we've compiled what I feel is an impressive working group that spans lots of different backgrounds. We have people in various levels of training, residency and medical school. We have Angela's PhD candidate. We have medicine folks, non-medicine folks associated with Dal. We've got international medical students, and we've got the representation New Brunswick and Nova Scotia. So I'm sure there's opportunities to improve this list further, but I think we're off to a good start. So planetary health, perhaps everybody on the line, on the call, has a good handle on this, but starting off, there may be some gaps, and certainly some people throughout the medical school and involved with the curriculum may need to wrap their head around a little bit in terms of what we're talking about here. And this is just one area that is still rife with some degree of debate. If you look at the long version of the Lancet's definition of planetary health, as the achievement of the highest attainable standard of health, well-being, equity worldwide through judicious attention to the human systems that shape the future of humanity and Earth's natural systems that define safe environmental limits within which humanity can flourish. And that's been dumbed down to the health of human civilization, the state of natural systems on which it depends. And then there's a number of other definitions and one similar view of things. It's a field focused on characterizing the human health impacts of human-caused disruptions on Earth's natural systems. And I think there's an opportunity to have a discussion like this or at some other time and spend hours on an appropriate definition for planetary health and the subtle nuances that go into these definitions. And there's probably a worthwhile form for that. However, the way I see it as a surgeon in very cut and dry, simple terms, we're having more major climate events, and my daffodil shouldn't be coming out of the ground in December. So however we want to frame the definition, there are changes going on within this planet, and those changes have an impact on humans and on the healthcare that we deliver. And I think it's important that that we start to reflect some of these things in the content that we're teaching, and we can allow some of these definitions to gel over time. So climate change itself has been declared this century's greatest public health threat, and the unfortunate thing, which I guess isn't too surprising the way a lot of things go with humanity, is that there's a disproportionate effect on the people that are least responsible for the problems, meaning that developing countries are going to bear the brunt of what developed countries do. And I think it's important that we bear some responsibility for that and start to work towards positive change. So where does this fit into healthcare? Well, this is just across Canada, a couple of examples, right? And there's probably many, many more examples. But anywhere from airborne particulate matter that affects the affects the respiratory system, to impacts on the nutrition that we need, increases in any sort of zoonotic disease or tick-borne diseases, for instance. We've heard about heat-related problems. We live in Nova Scotia, we're seeing coastal erosion, etc. So these things all are occurring. We're all recognizing them, and they all have impacts on health. But our challenge is to package this in a way that can be used positively to feed back in terms of the problems that are occurring, and also take care of people as they're suffering from these. So this slide I just put up, this is just a breakdown, and because this is a little bit of, this is where I kind of went a little off track from what we were initially asked to do. So the initial ask was about the planetary health. Now this is from the Government of Canada website, looking at different sectors within Canada as they pertain to the greenhouse gas emissions in 2018. And I put this up here because if we were to carve out the proportions of these different industries that relate directly to healthcare, we would get a wedge of pie somewhere between 5 and 7%. So healthcare itself, the delivery of healthcare and all the systems that go into that, are actually significant players in the amount of greenhouse gas emissions that that we in Canada and elsewhere in the world are contributing. So I think it's important, and we work this into some of the things in the recommendations, is that we should also be educating and addressing how we are contributing to the problem, not solely focused on the problem's effects on our patients. I think both things are important. So we have a big problem. We're part of the problem. So I think this is an opportunity to look at opportunities. So that first little preamble was to try to put context around where we are at Dal and where we can start to find ways perhaps to improve on things. So there's a bit of literature that's very directed, which was helpful because this was kind of a collation of all the other literature. And you know, I've got to say, hats off fully to the younger generations, if you will, and my apologies if that's offensive, but the students and even people that aren't in medical school yet are the ones that are really championing this cause more than I think people perhaps in my generation. So hats off to the Canadian Federation of Medical Students who put together this report. There's another report out of Europe that is a little more detailed. It just came out within the last month, but has a lot of good information in there. So those are the two primary areas, I think, with ease that we can draw suggestions and evidence from. So overall, the Canadian Federation of Medical Students, I mean, they've done some surveys across the country at the different medical schools to see what sort of planetary health education is already going on within the curriculum, and it looks good when Dalhousie is flagged as I think from reading it, one of the more advanced, if you will, curriculums. But I think we also have to look at the bar being very low. And I don't think that we should say, hey, we look good on this, let's stay where we are. Again, kudos to many people on the on this working group that have been involved with this, both at the faculty level as well as the medical student level. And I think that we can increase what we have been doing here at Dal. So there's a lot of involvement at both the faculty and student level. There's one dedicated lecture to environmental health, environmental medicine that was identified. And this lecture can sometimes be delivered in ways that are a bit more historical, perhaps, environmental medicine as it pertains to a workplace and things like that, and not perhaps as broad as what we thought we might be able to get towards in a broader planetary health aspect. So good, but with an asterisk. And I think that another strength that was identified is there's a lot of opportunities to incorporate into research, and hopefully this can be exploited some more. What are some opportunities? Increased teaching on sustainable health practices, getting to the point that we have an impact on the climate. And there's probably an opportunity to advance or blend more topics in the first 2 years of education. So then coming to recommendations, just to try to keep our time on track. So there's a gap, despite increased awareness of the impacts of climate change, pollution, et cetera, there is limited attention to planetary health within the curriculum. How that goes and where it falls in, some suggestions, but certainly open for conversation. Integrating these topics, however, a recommendation through the curriculum is advantageous as it gets a longitudinal approach and it gets to cover a number of different topics. And this can probably be done by building these learning objectives, not as the major objective, not to overtake the cases, but I suspect that probably every single case could, without too much difficulty, bring one of these topics in to start to raise awareness. Along the same lines, there's probably some merit in and building in structured lectures a little bit more on the planetary health, maybe a couple of times a year within the first and second year. And then recommendation number 3 is just the same idea, but as things pertain to the delivery of healthcare. And I know, I recognize, I've listened to a few of these town halls. Like, we don't have unlimited time to introduce unlimited content. So I'm not suggesting that this is in addition to the recommendation number 1, but it can be built in. And, for example, there could be a discussion when doing a case on respiratory medicine or asthma about the difference between dry inhalers and meter dose inhalers, right? And that's the kind of thing that we're kind of talking about here, where these things could be introduced as discussion points. And lastly, I think there is a lot of content here, and it's probably worthwhile having a couple of people, maybe with slightly different backgrounds, to provide facilitation into the integration of this content and serve as resources, potentially for content, but also potentially for people interested in the RIM project. So I'm not going to go over this in great detail. It is submitted in the handout that people have access to, but this just draws on the competencies that have been identified as potential content from the Canadian Federation of Medical Students document, and where this may start to fall in, just kind of as a visual. Evaluation, there'll probably be a degree of evaluation that can be incorporated into the current assessments. I think, where we're at now, I think raising awareness is an objective that we want to have, and our assessment should be not solely, I think, at this point, assessments of students, because we're trying to raise awareness, but our assessments should really be self-assessments on are we delivering the content. Challenges, evolving fields, time's tight, it's hard to get new content in. Experts, for some people doing tutorials, this is not going to be a familiar topic, but I think there are ways to work through that. So that's a little bit over 15 minutes, but I'll open things up for lively discussion, I think. Am I still here?
Yeah, you are. So thank you very much. So please raise your hand, and Ann Whedon will signal who goes first and second. And if you don't know how to raise your hand in the chat, it's the little icon. Yeah, you can even just wave, or you can hit just to the left of the little 3 dots on the top of the Microsoft. So comments, reflections. Perhaps I'll start off, Dr. Christie. So you mentioned about introducing lectures, and we really have very little time in our current curriculum for lectures. And from a transfer of knowledge, lectures are not particularly effective at transferring knowledge. So had you thought at all about perhaps modules, online modules that students could look at and begin to do self-assessment and questionnaires, and have something like that would be probably more fun to do?
Yeah, no, I think that's a good suggestion. When I was mentioning lectures, we're on the order of perhaps 1 or 2 in each of the first 2 years, and maybe that's too much, or maybe we can carve out a little bit of space for that. Your point, I think, is well taken. There was a session organized through the Healthy Populations Institute, and one of our team members actually was involved with that, driven by students and things. So I think that there are opportunities to expand that sort of thing. That would be kind of a global thing, because it would be open to everybody, not directly to the medical school. So I guess, although on the one hand, I think that that's realistic and good, on the other hand, I wouldn't want that to get lost. I guess it's just how we do things in terms of if we're having an evaluation of the medical school in terms of how things are delivered, that doesn't get missed as part of the medical school because it's slightly outside. So, but I think that that's certainly remediable.
Yeah, I mean, just as an example, we do use modules, for example, in the RIM course through the, the statistical, and so the students have to do them, but they can do it at their own, on their own time, and it's, the placement, like when you learn something, often helps more. It has as much to say whether you're going to retain that knowledge, right? If it's at the right time. So, the only other question I had was, as well as that. Did your group think at all about what we could be doing as a medical school, leading even the hospitals in terms of waste reduction? I'm just thinking about Mike Brennan and what he's been doing up in the hospital in terms of reducing waste. And we have become such a throwaway society, and it made sense in terms of infection control. I'm thinking back to the early days of HIV, and things changed dramatically, but we've learned a lot since then as well in terms of how to reuse things. Any thoughts about that?
Yeah, absolutely. So I think that that's a very important thing, and Mike has been doing a lot of great work for a long time, and I think could have done more if he was given a bit more leeway, perhaps. Daniel Rainham and I, who he's in our group as well. We have a number of projects and initiatives here looking at that sort of thing. So that would fall into the category of our third recommendation. I gave the example about dry inhalers versus meter dose inhalers, but you can have the same. Someone's had a surgical case, and the question is, someone raises their hand and says, "Why are we throwing away our gowns? Why aren't we reusing gowns?" And you can have a similar discussion around those health-related waste issues, which I think are a problem. Yeah, so that's absolutely.
Duncan Webster, go ahead. You can unmute and ask your question or give your comment.
Sure, thank you very much. I think this is very exciting and happy to be involved in this. I echo the comments about waste reduction. I see that as very important. And I think, to get this into the medical schools is important. Will hopefully permeate a little bit into our healthcare system. I started my day off today by finding a memo on my desk that every time I come into the hospital, I have to use a brand new mask as part of COVID restrictions. And I doubt that there was any thought at all put into that from an environmental, ecological, planetary health perspective. It doesn't weigh into decisions at all. But I think we need to get that into the curriculum, and it needs to permeate into our culture more. The other thing I'll throw in there, as an infectious diseases physician, a ton of the work we do day to day is related to planetary health. We're constantly, when we're doing histories, taking histories, we're asking questions about exposures, animal exposures, etc. So it's a big part of infectious diseases, and I think something that could fit nicely into the curriculum. Tick-borne illness specifically, there are local experts. I mean, take Todd Hatchett as an example in Halifax. Todd would be one of our national leaders on Lyme disease, and there's a lot of good information. And it's for a lot of our meds who are going to stick around the Maritimes. Tick-borne illness is a growing issue that a lot of people don't have great insight into, and there's a lot of questions. So I think not only are we going to there's the potential there to give practical information, but also to start to build that concept of, the world and the environment around us really is connected to our day-to-day lives and our health. And as we see change in climate, we see change in vector-borne illness. And Lyme disease would be a very classic example of that.
Thanks, Duncan. I think couldn't agree more. I don't have anything to add except that Duncan was one of the faculty that were highlighted in the CFMS report. So thanks for your previous and ongoing support to this issue.
Yeah, my pleasure. Thank you.
Any other comments or reflections? Recommendations?
Jacqueline, go ahead.
Hi, everyone. I'm a medical student in my third year out here in New Brunswick. So I was actually part of the committee that helped to review our current curriculum a couple of years back with CFMS. And I agree with what Dr. Christie mentioned. The bar was quite low, so we looked very good, but I think we do have a lot of room for improvement. With reference to your comment, Dr. Sutton, about the time period at which we include modules, I think there could be a great benefit for students to have these modules in either Peer 3 or Peer 4 as we're gearing towards setting up practice, getting more comfortable in the hospital, learning about what's going well, what's not going well, and even just having sessions where we could reflect with physicians or with each other about what we're seeing in the hospital, what works and what doesn't work. And I've talked to Dr. Webster about this a lot, about setting up committees in the hospital that could actually make active change rather than simply teaching about it, because I do think that's an important part, but I think we're a long ways away from actually making change in the hospital. So if we were to set up those review sessions with our peers, with physicians we're working with, I think that could help keep the ball rolling and keep us thinking about what we can do differently in a more proactive way.
Thanks, Jacqueline. I think that's a very good idea, and hopefully we can see that moving forward. Again, she mentioned, but Jacqueline and Emma McDermott were the two medical students that contributed a lot from here and are continuing to be very active, and that's what we need.
Hi, I think it's Dr. Des Ledden. You can unmute.
Thanks, Anne. Sean, thanks. That's very nice work. It's a comment, really. One of the characteristics of the climate health issue is that it tends to be very siloed. So my question for you is, what's the linkage between the work that you're doing and Doctors Nova Scotia, the Department of Health, and regional government? Or do you see any way that those could be joined up?
Thanks, Des. So the answer is yes, and I'm about a week or two away from saying how that might work due to some signing restrictions that are going on. But suffice to say that there is, we're part of a national organization that's been trying to procure some funding to move some of these things together, and part of that will be involved with linking different levels, such as advocacy, Doctors Nova Scotia, or other provincial medical associations, universities, etc. Can't speak a whole lot to that, but there is something in the background, and I can tell you that Nova Scotia and Ontario and BC are going to be the three provinces that are hopefully doing that the most. This particular work didn't really get into that. Perhaps we can broaden the scope, but my understanding of the mandate was to really direct the medical school in terms of its curriculum. I recognize that it's a bigger problem. It needs a kind of a bigger lens, if you will. But we didn't. I think we're going to have enough on our plate to increase the awareness and the content within the medical school to try to tackle bringing in these other health authorities and other advocacy groups and things is probably beyond the scope of this committee, but it's work that needs to be done. That would be my thought, unless Dr. Sutton wants us to broaden things out, I'm game, but I think that we have enough on our plate with the medical school.
I completely agree, but I think in the big picture, as we educate our students and ourselves, that they're the workforce of tomorrow, and they will be influencing the politicians, the people sitting around and making the decisions. So we have to start with what we can and carve that out. And I see that there was a comment in the chat that this might be a role for service learning. So in terms of reaching out into the community, but I think we have a big enough task, a job on our hands in terms of curriculum refresh and incorporating. But yeah, lots of great ideas. But I see that in the long haul for sure. Is the future. Any other comments or questions? Yeah, how we change systems, I think eventually is going to be the big picture here. But we don't keep on doing business as usual and ignoring what we're doing to our planet.
Yeah, I think, my personal observation is that for whatever reason, we seem to have gotten or feel like we should get a pass on a lot of these things because we're in medicine, but I'm not really sure that's correct. But
yeah, I completely agree. Any other comments or questions? So not seeing anyone, I just want to remind everyone that you can submit additional comments for the working group's review by emailing to ugme@dal.ca. And I want to thank Dr. Christie and members of the working group for the work you've completed to date as part of the curriculum refresh process, and thank everyone who attended today's session. This is the last of the medical school, the medical community town halls. But again, thanks everyone, and don't be strangers. If you have any comments or suggestions you want to share, all will be reviewed and most welcome.
thank you, Dr. Sutton. Thank you, everybody.
Thanks everyone.
Thank you.